for including me in this IC, and being one of his good friends, he has to include me because I'm an oculoplastic surgeon and we are a rare species. Um, so I'll be talking about the journey of an oculoplastic surgeon. What I realized, I'm not at the end, of course, but somewhere in the first one third of the journey, is that there's no rule book for success. But the most important thing is to learn from your mistakes. With respect to oculoplastics, I'll be just talking about it with respect to eyelids, the orbit, oncology, aesthetics, and lacrimal. Before we go into this, however, the most important thing is the basics. It's important that when you enter an oculoplastics fellowship, that you're well versed with tissue handling. So, handling the skin, the various underlying tissues, the sac, and it's important to know all your suturing techniques, be it interrupted, continuous, subcuticular, interlocking. These are all techniques we use on a daily basis. The other thing that your fellowship teaches you is how to differentiate between normal and abnormal tissue. So it's important that you are a safe surgeon and you do exactly what's best for your patient. The other thing you realize is that not only your preceptor of your fellowship or your consultant teaches you, you learn the maximum from your seniors. So when your consultant is gone out for tea, the only person who is there to help you is your senior. So you learn the maximum from the person who is just ahead of you in the fellowship, whether it is surgery or even interpreting a CT, MRI. It's important that you look towards your seniors for help. Transitioning from old to new. So when you work with an older practitioner, you realize the things that they have not been exposed to recently. So whether it is transitioning from naked eye surgery to using an operating microscope to operate, most oculoplastic surgeons now are getting better mobility and visualization because they are using nice sleek loops which are very comfortable these days. And also shifting from performing external DCRs to endonasal endoscopic DCRs. These are things which you learn to become comfortable with the help of a fellowship. So before you go ahead and become an independent surgeon, it's important that you know how to assist, because if you don't know how to assist, you don't know how to make your assistant assist you later. So once you become a good assistant, then you know how to make yourself comfortable when you go back to your own practice. Finally, operating under supervision. It's important not to get stressed or anxious while you're operating, because in that, only if you're in a little bit of a zen mode can you take instructions from your mentor. So go ahead with a clear mind, revise all the steps of surgery while you scrub for the case, and you shouldn't have any issues. Finally, going back to your practice and teaching others. This is probably, I feel, till now the best way of learning, because there were things which our fellow did which I didn't even know was possible. So you learn, you get your learning curve cut short by teaching others. Learning to do things the right way. So some patients that you see who have been operated elsewhere, who've not undergone, let's say, a proper margin excision or a proper histopathological examination. These are the things which you learn in a fellowship. How to document histopathology well, how to send a proper sample, how to cryo the edges where you're supposed to, whether it is double freeze thaw, triple freeze thaw, whatever technique you're supposed to use. These are the things which are learnt best by doing a fellowship. With respect to oncology, it's not something which is practiced everywhere. So if you learn it in your fellowship, you could be one of those few people who ties up with a nice multi-specialty hospital and starts a good oncology practice, and then you can be the watershed area for oncology. So it's not something which everybody does, but once you do it, once you follow a protocol-based therapy, you can offer the best results to patients. The other thing you learn in a fellowship is very rare thing. So for example, this is a time when I was allowed to do intraarterial chemotherapy. I had no idea what it was. I had no clue what it involved. But once I went with the interventional neuroradiologists and did the procedure, then it was something which I could safely say that, okay, once I saw the follow-ups that this works, I can advise it to patients, and it's not just a frivolous or expensive thing. Aesthetics is something which is sort of coming up in oculoplastics these days, wherein people are tending to oculofacial aesthetics. So it's a branch which people are starting to get exposure to. I know it's there in Shankar Dev Netralaya, for example. They do emphasize it a lot. It's coming up in LV Prasad. It's also there in Narayan Netralaya. So it's something which we really need to focus on. This would be a separate talk in itself, aesthetics, but if you don't offer aesthetics, you sort of lose out on a lot of patients, because there's something which is very important now, that is the post LASIK aesthetics. People who are getting rid of their glasses, they sort of end up noticing all their flaws. So if your refractive surgeon is not able to send you your these kind of patients who are worried about their dark circles or their hollow appearance of their eyes, you tend to lose out on patients. So it's important that you brush up on your basic dermatology, that is with respect to cosmeceuticals like sunscreens, basic serums, so that this is also something that you can cover in your practice. Academic opportunities are something which help you grow. So this is a cadaver dissection course that we had conducted for eyelid reconstruction. So in the process of teaching general ophthalmologists eyelid reconstruction, I ended up learning a lot based on their doubts, that where would we get tissue for this, or if we had less tissue, what would we do? So this is another good way of learning.
Rwituja, can you sum up in a minute?
Okay, the last would be instruction courses like this, which are very useful during your fellowship. And of course, here we're looking happy about collecting data for an Excel sheet, but this is something which actually helps you going forward to publish. And what I would like to say is, with respect to people across the country, oculoplastic surgeons, they all feel like aligning with other specialties is important. Making sure that you focus on things like trauma helps you with the clinical judgment, and learning happens with each and every case. So it's important that you sort of go into your fellowship with an open mind, and then go forward in your practice with an opener mind. Thank you.